Breaking Bread with the Boswells. I'm your host, Jonathan, covering this edition of Men's Health and Wellness. Our episode today is Navigating the Complexities of Grief. And Dr. Stanley Harris, an expert with over 47 years of experience in the field of healthcare, has done an amazing job clarifying the phases of grief, and he even shared tips on how to support individuals experiencing grief. Dr. Harris, there are at least 10 different types of grief, and since this is your field of expertise, would you please define for us the following stages of grief so that we can identify behaviors in others? And lastly, please give us some recovery techniques to use and to aid our family and friends when they're experiencing grief.
The first type of grief is considered as normal grief. And by definition, it simply means a natural response to the loss of a loved one,
Yes.
typically following the stages of grief. And it could be crying or, just, feeling real sad, those type of things. But the stages of grief associated with that include a shock and denial, pain and guilt, anger and bargaining, depression, the upward turn, reconstruction and acceptance and hope. And some recovery techniques that are associated with it include seeking support from friends, family members, or a grief counselor, attend support groups, engage in self-care, and allow time for healing. Time is a very, very critical factor. The next one is anticipatory grief. Anticipatory grief. By definition, this grief occurs before loss, such as when someone is diagnosed with a terminal illness. And when we say anticipatory, that means we anticipate that that person may die someday.
Right.
Because of that illness. Recovery techniques associated include creating lasting memories, such as an interview, a taped interview, whereby there's a video camera, that type of thing, and it can include other family members. It can include a certain scenery, like going to a park, or going to like the Healing Springs down in near Blackstone. Near Healing Springs, whereby people can go and just get some sunshine, get some fresh air.
So important.
And communicate openly with the individual.
Yeah.
Talk truthfully. Talk truthfully about how their their diagnosis of a terminal illness makes you feel. If it makes you feel sad, then say that. Seek professional guidance and lean on a support network. The next is complicated grief. And by definition, grief that persists intensely and disruptively for an extended period of time. It can be 3 months, 6 months, 3 days, 3 years, sometimes resulting in prolonged grief disorder.
Yeah.
Where the person actually becomes physically sick, physically ill. Techniques include, associated with recovery, consult a mental health professional. Consider therapy, like cognitive behavioral therapy.
Yeah.
And attend specialized support groups and practice self-compassion. We have disenfranchised grief, whereby grief is not openly recognized or socially supported, often associated with a non-traditional loss, like a pet, bereavement, or miscarriage. In our society today, lots of people consider their pets family members.
Right.
They have pet insurance. Absolutely. They take them to the hospital. They have like a health care insurance. Take them to doggy parks.
Yeah.
other things like that. And they think a lot of they think very highly of them. They regard them as another family member. And and it's hard, it's difficult for other people to buy into that.
Yeah.
And some recovery techniques that include seek out pet loss support groups or specialized resources, find empathetic friends or family members, and allow yourself time to grieve without judgment.